Hey everyone, and welcome. Today we're going to tackle one of the most fundamental skills in clinical practice, the pediatric abdominal exam. Now, I know it can seem a little daunting, but we're going to break it all down into a super clear, step-by-step guide. So you ready? Let's jump right in.
Okay, so here's our game plan. We've got 5 main sections. We'll kick things off with the setup, then hunt for some head-to-toe clues. After that, we dive into the abdominal exam itself, do a few final checks to be thorough, and wrap it all up with how to conclude and report everything. Think of it as our complete roadmap.
So, let me ask you this. What can you really figure out about a patient's abdomen without a single scan or test? I mean, really? The answer? A ton. It's amazing, actually. A really good physical exam is one of the most powerful tools we have, and you're about to see just how much information you can get from it.
All right, first up, the setup. And trust me, a successful exam starts way before you even lay a hand on the patient. Getting these first steps right, well, it sets the stage for everything that follows. Okay, these right here, these are the absolute non-negotiables. First things first, you gotta sanitize your hands. Simple, but crucial. Then, it's all about that human touch. You introduce yourself, not just to the parent, but to the child too. And you always ask for permission before you start. You know, building that trust isn't just a nice little extra. It's the foundation for getting a good cooperative exam. It makes all the difference.
Now here's a great little tool to keep in your back pocket, the 4 Ds. From the second you walk into the room, your observation starts. First D is dysmorphism. Are there any unusual facial features? Second, dimensions. You're just getting a sense of their height and weight. Third is distress, and this is a big one. They look like they're in pain or are they having any trouble breathing? And finally, devices. Are they connected to anything like an IV or a feeding tube? Following these 4 Ds gives you an incredible snapshot of the situation right off the bat.
Okay, moving on to our next section, hunting for head-to-toe clues. This is what I like to call the hand-to-system approach. Why? Because sometimes the biggest clues about what's going on in the abdomen, well, they're not in the abdomen at all. The body often leaves hints in the most unexpected places. So, let's start with the hands and arms. First, you're going to check the palms. Are they pale? That could be a sign of anemia. Then, have them hold their hands out straight. You're looking for something called a flapping tremor. That can be a big clue for liver problems. Don't forget to check the fingertips for clubbing. And feel their pulse. Is it really fast? That tachycardia could also point back to anemia. Finally, just take a look at the arms in general for any muscle wasting or old scars from previous procedures. See? Every single detail tells a piece of the story.
All right, now let's move up to the head and neck. Take a good look at their eyes. You're looking for jaundice, that classic yellow color in the whites of the eyes, or any paleness there too. Then have them open their mouth. Again, you're checking for pallor, but also for any bluish tint, which we call cyanosis. And look at the roof of the mouth. A high arched palate can sometimes be a clue for an underlying syndrome. Finally, just scan the neck for any scars, maybe from an old central line. These are all such important pieces of the puzzle.
Okay, here we go. It's time for the main event, the abdominal examination itself. Now we're going to bring all our focus right to the abdomen, and we're going to do it in a very specific, very structured way.
Now, the order we do things in here is absolutely critical. There are 4 key techniques, and you have to do them in this exact order: inspection, palpation, percussion, and auscultation. Why? Well, think about it. If you start poking and prodding before you listen, you could change the vowel sounds. So we look first. Let's break down what each of these means.
First up is inspection, and this is so much more than just a quick look. It's really the art of careful observation. You've got to look from different angles, so stand at the foot of the bed and then actually kneel down so you're at eye level with the abdomen. What are you looking for? The overall shape, symmetry, any scars, rashes, or any visible movements. You'd be surprised what you can see before you ever even touch.
Next up, we have palpation. This is where we use touch to feel for organs, any unusual masses, and especially for tenderness. And here is the single most important tip I can give you for this step. While you are palpating, you have to be watching the child's face. Seriously. Their expression, that little wince, will tell you everything you need to know about tenderness, way more than words ever will.
All right. After palpation comes percussion. This is the part where you're gently tapping on the surface of the abdomen. It might seem a little strange, but it's kind of like tapping on a wall to find a stud. The sound that comes back tells you what's underneath. Is it a solid organ? Is it full of gas? Or maybe liquid? This is how you can actually map out the size and borders of the liver and spleen.
And our final technique is auscultation. That's just a fancy word for listening with your stethoscope.
The main thing you're looking for are bowel sounds. Are they there? Are they super active? Or are they completely absent? You're also listening for something called bruits. That's a sort of whooshing sound that you shouldn't normally hear, and it can be a sign of turbulent blood flow in an artery.
Okay, let's zoom in on palpation for a second, because the sequence here is really, really important. You always start light, just gentle, superficial palpation across all 9 quadrants of the abdomen. Once you've done that, you go back and do it again, but this time with deeper pressure. Only then do you start to zero in on the specific organs, first the liver, then the spleen, and finally the kidneys, where you'll use a cool two-handed technique called ballottement. See? It's a very logical flow, from general to specific. So when you do feel an organ like the liver or the spleen, it's not enough to just say, yep, I feel it. You need to be able to describe it. And this table shows you exactly what to look for. How big is it? What does the surface feel like? Is it smooth or bumpy? Are the edges sharp or rounded? Is it soft, firm, or hard? And for the spleen, there's a specific notch you might be able to feel. Getting these details right is what makes your report clinically useful.
Okay, here's a really neat and super important skill to master: how to check for ascites, which is just fluid buildup in the abdomen. The technique is called shifting dullness. Here's how it works. You start percussing in the middle and work your way out to the side until the sound goes from a hollow, resonant sound to a dull thud. You keep your finger right on that spot. Then you have the patient roll onto their other side. You wait about 30 seconds, just let gravity do its thing and move the fluid, and then you percuss that exact same spot again. If the dull sound is now resonant because the fluid has moved away, boom, that's a positive test.
All right, we're on the home stretch now. But listen, just because you're done with the abdomen doesn't mean the exam is over, not by a long shot. To really get the complete picture, there are a few final physical checks you absolutely have to do.
So, what does that mean? Well, you'll want to have the patient sit up. This lets you check their back. You're feeling for swollen lymph nodes, checking for tenderness over the kidneys, and looking for any swelling down low or sacral edema. And while they're sitting up, it's a perfect time to check for separation of those six-pack muscles. After that, you move down to the lower limbs, checking for swelling or edema, looking for clubbing in the toes, and feeling for their pulses. It's all about leaving no stone unturned.
And that brings us to our final and maybe one of the most crucial sections, the wrap-up. Because how you finish the exam and report what you found, that's just as important as how well you did the exam itself.
You know, one of the biggest ways to show you really know your stuff is to demonstrate that you're thinking beyond just the steps you just performed. You're thinking about the whole patient. And that means you need to be able to say what other checks you do to make the exam truly complete.
So, especially in a testing situation, you'll want to use this exact kind of phrasing. You'd say something like, to complete my examination, I would also like to examine the hernial orifices, the genitalia, and perform a full lymph node examination of the entire body. Saying that signals to the examiner that you know what a truly comprehensive workup looks like. It's a total pro move.
When it comes time to actually present your findings, you need to be super systematic. Start with your positive findings, that's anything abnormal that you found. But, and this is so important, you also have to mention the important negatives. These are the relevant things that you looked for but didn't find, like no clubbing or no stigmata of liver failure. It shows you were looking for them. And of course, the very last thing you do every single time is thank the patient and their parent. It's just the right thing to do.
So there you have it. It's pretty incredible how much a systematic, thoughtful physical exam can tell you, right? It really makes you think. If a person's hands can tell you a story about their liver, just imagine what other secrets the body is waiting to share with us if we just take the time to really look and to really listen.